Hi, I'm Camille from Pareto Education and welcome to our YouTube channel. Today we'll be talking about falls history and how to take an effective one. Be sure to like, subscribe and click that little bell icon for more awesome content. Falls can result from various causes and it's important as a clinician to be able to decipher between the causes. Whilst typically they do occur in the more elderly patient population, they can occur at any stage. It's important during our history to take a timeline of when the fall occurred, focusing on what preceded the fall, during the fall, and the events immediately after the fall. It's important to also assess the patient comprehensively by asking about if there has been other falls and what can be the causes of those. When taking a history, focus on the key causes, including cardiovascular causes, arrhythmias, orthostatic hypertension and syncope, neurological causes, looking for stroke, Parkinson's disease and peripheral neuropathy or vestibular disorders. Other factors such as muscle weakness, vision impairment and environmental hazards. Important that you take all of this as part of your history to investigate other possible causes for the fall as well. At each stage, ask about specific contributing factors. Examples of this include medication reviews, identifying sedatives, antihypertensives or significant polypharmacy. A physical exam, checking the vitals, orthostatic blood pressure, gait and the balance. You may also be asked to present a management plan. Common investigations for this include an ECG to rule out arrhythmia, blood tests looking for anemia, electrolyte disturbance, glucose levels and creatine kinase if you're suspecting a long lie. Finally, you may also ask for some imaging such as a CT scan if you're suspecting an injury. So they're the basics. So let's see a falls history in action. Glenn, are you okay there? I've just been asked to review you. It looks like you just had a fall.
Yeah, I had a fall and I just feel dizzy.
Oh, I'm so sorry to hear that. Let me get you some water. Have you been looked after?
No, I've had a drink, thank you.
Okay. Are you okay just to tell me what's happened? I want to do a quick examination after as well.
Yeah, absolutely. Thank you for coming and seeing me.
Yeah, sorry, I just want to introduce myself. My name's Camille and I'm one of the physician associates.
No, thanks so much for coming over to my home. Thank you.
Right. So tell me about this fall. What happened?
I don't know. I mean, I got up in the morning and I went to go to the toilet. I got up and started walking and I just felt so dizzy. I felt lightheaded, dizzy, and then I've just fallen down.
Oh, I'm so sorry.
It's not the first time this has happened and that's what's worrying me.
How many times has it happened?
I'd probably say at least about 3 times in the last 6 months.
Okay. And did you have someone to call you out every time?
Well, I have a pendant alarm, you see, and I think it was my neighbour that's called the practice and you've come out.
Okay.
She's really nice. She really looks after me.
Okay. I'm glad to hear that. How long were you on the floor?
Not too long. I think they were worried about injuries and all, but I managed to get myself up and into the seat.
Okay.
But I don't know why I keep falling.
So Glenn, I'd like to quickly do an examination. This is just checking your neurovascular system, cardiovascular, your heart, your lungs, and just to see if you're okay and any spots of pain and bother. We'll just look at that now, okay?
Okay, yeah, we'll do that first then.
Right, everything seems to be okay, which is good.
Good.
Right, so I'll take a bit more of a history from you, okay?
Okay.
So you've said you've had a couple of falls in the last couple of months, and this one looks to be the most significant. So you said you had a fall this morning, you woke up and you felt dizzy and things. What happened?
So as I said, I went to sleep as normal. I've been feeling well over the last few days. I've been fine. I mean, I am 86, but I'm all right with what I do. And yeah, I just got up and then all of a sudden started feeling dizzy and then, next thing I know, I'm on the floor.
Did the room start spinning or did you feel off balance?
I think I felt off balance. It definitely wasn't spinning.
Okay, and did you feel lightheaded at all?
I felt so lightheaded.
And you said you've not been unwell in the past couple of days.
I've been all right.
Any ear pains or anything like that?
Not that I've noticed.
Or any ringing in your ear?
No, not really.
Okay. Anything unusual for the past, like a viral infection, feeling down in yourself, anything like that?
I've had no coughs and colds. Okay. Honestly, I've been all right.
And was it the first thing that happened when you woke up this morning? Is that right?
Yeah, pretty much.
I'm sorry to hear that.
No worries.
Did you have a good tea last night? Did you have food and drink, etc.?
I did, yeah. I had a good dinner.
Okay. So it's a bit unusual to happen. So we'll go through history just to see if there's anything that pops out as a cause of this fall.
Sure.
Because although you're 86, it's not something that we should expect someone to be experiencing as a fall.
Thank you.
And as you know, falls can be quite dangerous, can cause injuries, can cause broken bones as well.
I'm so fortunate I'm all right.
Okay. Did you experience any breathing difficulties?
No, my breathing's been all right.
No chest pain?
No chest pain.
Did you feel any funny heart rhythm?
No, I think heart's been all right.
Any pins and needles or weakness in your legs or arms?
No.
So no weakness as you woke up. And you live by yourself, is that right? Okay, and I can't notice when I examined you, any weakness or lopsided of your face either. Okay. During this period of, you fell, were you unconscious or did you...
No, I pretty much remember everything that happened.
You do remember?
So I don't think I went blank.
Okay, and did you lose any incontinence, anything like that?
No, that would be so embarrassing, but no.
Okay, that's good. And do you have any lip injuries or tongue injuries, anything?
No, nothing like that.
Okay, that's good. And definitely no seizures or activity or anything like that. How long were you on the floor for? Do you remember how long was the fall for?
Well, I mean, I fell and then I pressed my pendant. So I probably was on the floor for maybe 5 minutes.
Okay. And what happened after that?
So my neighbour came and she saw to me. I responded immediately. She called 111 and then they asked for her to contact yourselves. And
okay.
That was it.
Fine. So that's good. So then you were able to get up and, you didn't forget about the event or anything. You know exactly what went on.
Yes.
Okay, perfect. And in terms of pain anywhere, where's any pain? Do you have any pain at the minute?
I've got no pain. I'm all right. You've obviously checked me out. I don't think I've got any injuries.
Okay, brilliant. So one of the key questions, Glenn, for yourself is there a pattern to these falls? For example, does it happen a time of day? Does it happen on a certain type of action? Is there a recurrent theme that you've noticed?
It's a good question. I mean, I've noticed that whenever I'm lying down or sitting down and then I get up, that's when I'm just overcome with this lightheadedness and wooziness.
And how do you normally help yourself in that situation?
I just have to grab whatever's around me. Of course, this time, because I was getting out of the room, going towards the toilet, I didn't really have anything to grab, and I think that's why I've fallen.
Okay. So we'd like to go over your past medical history, if that's okay, just because that gives us more of a picture of what's the reason behind the fall. You didn't see any sort of trip hazards before you fell or anything like that?
No.
Okay.
House has been checked from that point of view.
Perfect. So tell me about your past medical history.
Well, I've got quite a few things. I've got type 2 diabetes, hypertension or blood pressure. I've got COPD, and those are the 3 big ones really.
Okay. And is your diabetes controlled with medications, insulin?
I think everything is a little bit touch and go. I think especially my blood pressure, my diabetes, trying to work out how to get it under better control.
And how are you managing that at the minute?
So I'm on a few medications. I'm trying to sort my diet out, but I'm on a few medications. I'm on metformin, I'm on gliclazide, and also I'm on a few medications that they want to start me on, but I haven't yet been initiated.
Okay.
There's also, I'm on candesartan for my blood pressure, and also bendoflumethiazide. I think I've said that right.
Okay, good. Yes, good.
And they're still trying to work out my high blood pressure. And I'm on a couple of inhalers for my COPD.
Okay, we'll get those checked out for you so we can get the doses and things like that. So we call it titrate when we change the doses and things. Do you mean it's because of your kidney functions or other reasons, or is because your blood pressure is a bit up and down and it's not?
Everything is a little bit up and down.
Okay.
My blood pressure's unfortunately still high.
Yeah.
My sugar levels are still a little bit high, and they're just keeping a really close eye on me.
Okay, brilliant. So all those medications obviously can play a part as well. That couldn't be part of the reason why you fell, but we should get to the bottom of that really, because to have good blood pressure control, one will prevent any complications, but it looks like that could be an underlying factor for the reason of your fall as well.
Maybe.
When was the last time your blood pressure was checked regularly?
I mean, I have to do it every 8 weeks.
Okay.
I come in for a check, so I'm not due until about 6-7 weeks.
All right. And have you had like a 24-hour monitoring, or how was it first diagnosed? Do you remember?
I don't even know what that is, to be honest.
Okay.
But they just did my blood pressure, and then they said it was really high.
Fine.
And they started me straight away.
Okay. So sometimes we just test the blood pressure at regular intervals just to see if someone's truly got high blood pressure, because some of these medications, like I mentioned, have side effects.
Okay.
And how are you normally, just going forward in terms of the questioning, are you normally able to go about your normal chores, looking after yourself?
I use a stick. I'm no spring chicken, but I use a stick, and I'm generally all right on my feet.
Fine. All right. Well, I think as part of this review, it's important to get a few investigations done.
Okay.
I'd like to perform a few tests if that's okay. One of those is a blood pressure check, of course.
Okay.
So we get your blood pressure while you're lying down, while you're sat up, and while you're standing as well.
Okay.
And that will see if there's any drop in your blood pressure while you're standing. That can sometimes be a cause of something called orthostatic hypotension, which is just a way of saying when we stand up quickly, especially, it cause a drop in our blood pressure.
Right, I see.
And also gives us a baseline about the medications that you say that you're currently taking, if they're effective for yourself.
Sure.
At the current doses.
Okay.
I'd also like to perform an ECG if that's okay. So heart tracing, just to see if everything's regular with your heart. I'd also like to check your blood glucose as well. I know you've had some water already, but just to see if the blood glucose is adequate at this time of morning, that can also cause you to feel a bit woozy as well.
Okay.
All right. I'll also take some blood tests as well, just to be on the safe side. Things like your full blood count, kidney functions, liver function tests, thyroid functions, etc., just to see if everything is all right. Okay. And this will give us a bit more of a picture about why you fall, because like I say, although you're 86, we just want to keep you in the best of health, and any fall can present with issues later down the line, such as fractures and things like that. I'd also like to get a review with your pharmacist, just to see if you're on all the right medications for yourself and all the right doses as well.
Sure.
So everything's clear.
Sounds really comprehensive.
Yeah, so we'd like to do that before we can sort of say what the reason for the fall is.
I appreciate that.
Is that okay? Do you have any questions at the minute?
No questions. Thank you so much.
So sometimes after a fall, people can lose confidence a little bit as well. So maybe, would you think any physiotherapy would help you gain confidence, or are you feeling like that you'd be okay to walk again?
I think I'm okay for now, but I'll definitely keep that option in mind.
Perfect. That's brilliant. So nice to meet you, Glenn.
Thank you very much.